This medication is used to treat rheumatoid arthritis, a condition where the body's own defense system attacks healthy tissue, causing swelling in the joints, pain, and difficulty moving. It is also used for other types of arthritis and to prevent a certain problem after a stem cell transplant. Abatacept works by weakening the immune system, which helps to slow down joint damage and reduce pain and swelling for better mobility. Before using Abatacept, make sure to read the patient information leaflet. This medication is usually given by injection into a vein as directed by your doctor. For arthritis, it is usually given every 2 weeks for the first 3 doses, then every 4 weeks. For graft versus host disease prevention, the first dose is usually given the day before transplantation and then on days 5, 14, and 28 after transplantation. Make sure to take all other medications prescribed by your doctor exactly as directed. The dosage is based on your medical condition and weight. Infusion reactions may occur, so tell your doctor if you experience symptoms such as shortness of breath, dizziness, or headache. Use this medication regularly and mark your calendar to keep track of when to receive the next dose. Tell your doctor if your symptoms do not improve or if they worsen. If you experience headache, nausea, or cold symptoms such as a stuffy head/nose, it's important to notify your doctor or pharmacist. Since this medication weakens the immune system, you may be more susceptible to infections, so be sure to contact your doctor if you develop signs of infection such as a persistent sore throat, fever, or cough. In rare cases, patients using Abatacept have developed cancer, so it's important to report any unusual lumps, skin changes, or unexplained weight loss to your doctor. Additionally, if you experience symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before using Abatacept, it's important to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other problems, so be sure to talk to your pharmacist for more details. It's also important to tell your doctor or pharmacist about your medical history before using this medication, especially if you have cancer, chronic obstructive pulmonary disease (COPD), or any current, recent, or returning infections. Abatacept can make you more likely to get infections or make current infections worse, so be sure to stay away from anyone who has an infection that may easily spread, like chickenpox, COVID-19, measles, or the flu. If you are using Abatacept, be sure to tell your healthcare professional before having any immunizations or vaccinations. Certain types of vaccines should not be given during or within 3 months after the last dose of this medication. Children using this medication should have all recommended vaccinations before starting treatment with Abatacept. Some Abatacept products are made with maltose, which can cause false high blood sugar levels. If you have diabetes, ask your pharmacist if the product you are using contains maltose and if your blood sugar testing supplies will work with this product. It's important to be aware of this because serious problems have occurred when too much insulin was given because of false high blood sugar readings or when low blood sugar went untreated. Before having surgery, be sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication when clearly needed, so be sure to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Some products that may interact with this drug include anakinra, rituximab, and TNF blocking agents. This medication may also interfere with certain lab tests, so make sure to inform the lab personnel and all your doctors that you are taking this medication. If someone takes too much of this medication and has severe symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they should contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Before starting Abatacept with maltose solution, you should have lab and medical tests done, including a tuberculosis skin test, a test for hepatitis B virus, and skin exams. It's important to keep all medical and lab appointments and consult your doctor for more details. Be sure to take each dose of this medication according to the schedule. If you happen to miss a dose, consult your doctor or pharmacist immediately to establish a new dosing schedule. This medication is only given in a clinic and cannot be stored at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.